What is resilience and distress? Resilience is what gives people the psychological strength to cope with stress. Distress is an unpleasant emotion, feeling, thought, condition, or behavior. Resilience and distress can be divided up into 5 groups: emotional, physical, spiritual, behavioral, mental resilience. Emotional resilience can be defined as the ability to adapt to stressful situations and cope with life's stresses. The characteristics of emotional resilience are self-awareness, acceptance, bouncing back, coping with stress, optimism, positive relationships. Emotional distress can be defined as a negative emotional reaction, which may include fear, anger, anxiety, and suffering. The characteristics of emotional distress includes inability to eat, sleep, or concentrate, negative outlook or depression, thoughts or attempts at self-harm, irritability and inability to control anger, impulsive behavior, feelings of helplessness or hopelessness, fearfulness, nervousness or anxiety, feeling emotionally numb or detached, inexplicable sadness, flashbacks to traumatic events, confusion or disorientation, extreme mood swings, loss of work ethic or social functionality, poor self-care. You can improve emotional resilience by knowing yourself, your strengths and weaknesses, keeping a journal, practicing optimism, learning to manage your stress, seeking advice from a trusted professional when necessary. Physical resilience can be defined as the body's capacity to adapt to arising challenges, maintaining stamina and strength when facing demands, and recovering efficiently and effectively. The characteristics of physical resilience include knowing your limits, eating a balanced diet, balanced physical activity, avoiding substance abuse, taking care of yourself, regular checkups. Some physical diseases are thought to be particularly prone to be made worse by mental factors, such as stress and anxiety. Your current mental state can affect how bad a physical disease is at any given time. Characteristics of physical distress include recurring pain in joints, muscles, or elsewhere in the body, high body mass index or obesity, difficulty breathing, abuse of substances, unexplained exhaustion, insomnia, difficulty sleeping, poor eating habits, poor safety habits. I can improve physical resilience by maintaining a diverse exercise schedule, listening to my body, cooking more, eating out less. Little adjustments go a long way. Practicing sleep hygiene. Mental resilience is the ability of an individual to respond to stress and adversity in a healthy way. Characteristics of mental health include outlook and perspective, self-belief, positive self-talk, ability to reframe any negative thoughts, sustained focus, setting boundaries, relax and let go, ask for help, count on friends, breathing, visualizing, gratitude, self-acceptance. Mental distress happens when a person feels stressed, sad, or depressed, or has difficulty managing their emotions. Characteristics of mental health distress include difficulty letting go of mistakes, negative perception of oneself, depression, frequent expressions of negativity, paranoia, mental exhaustion, high levels of anxiety, powerlessness, hopelessness, increased frustration and anger, confusion, disorganization, difficulty concentrating, forgetfulness. I can improve mental resilience by improving mindfulness, self-awareness, purpose, self-care, decision-making, positive thinking, problem-solving. Spiritual resilience is the ability to maintain one's sense of self and purpose in the face of hardship, stress, and trauma by drawing on both internal and external spiritual resources. Characteristics of spiritual resilience include contemplating your purpose, achieving greater mindfulness, harmony with one's surroundings, balancing one's personal needs, personal values and beliefs, acting compassionately. Spiritual distress is defined as a disturbance in a person's belief system. Characteristics of spiritual distress include loss of direction, lack of purpose, sense of emptiness or feeling alone in the world, hopelessness and helplessness, withdrawal from family and friends, self-destructive language, bitter or jaded outlook on life, fearfulness, disassociation, anger at God or a higher power. You can improve spiritual resilience by finding some quiet time, saying out loud how you feel and where you get your strengths from, asking the big questions, finding out what you believe, be true and honest with yourself. Behavioral resilience can be defined as the conduct, routines, and habits that promote health. The characteristics of behavioral resilience include practice healthy sleep hygiene, positive coping behaviors, actively involved in self-improvement activities, maintain physical health fitness regimen, responsible use of alcohol, smoking, prescribed medications, participation in support groups, awareness of resiliency level, possess ability to engage in healthy coping behaviors, meditation and mindfulness. Distressed behavior is displayed more frequently by persons who are depressed or experiencing chronic pain. Characteristics of behavioral stress include poor grooming, physical appearance, unusual behavior or sudden change in behavior, poor work performance, difficulty maintaining normal activities, reduced work productivity, increased frustration and anger, sudden loss or increase in weight. Illness, physical problems, defensiveness, overly suspicious, gambling or overspending, increased alcohol usage, increased smoking. You can improve your behavioral resilience by practicing stress management techniques, practicing good sleep hygiene, exercises, practicing cognitive restructuring and reframing, accepting change, learning from mistakes, nurturing a positive view of oneself, set goals and be proactive in pursuing your goals, have an accountability buddy. By working to strengthen these 5 pillars, we are becoming more resilient, and as a result, we are much more equipped to manage the stress in our lives.